elderly like me, the best is this. When you got a social worker, trust them. They can help, they try their best to help.
In Singapore, about 6 new patients are diagnosed daily with kidney failure. And these patients usually suffer from other diseases or require special assistance and treatment, apart from the medicines, nurses, and doctors. What about their daily routine or transport arrangements? And something we usually overlook, their mental load and stress. In this series, we look to discover what goes beyond the happy faces and smiles of seemingly normal patients and how we as a society can progress with them. MOH's Community Care Framework outlines physical, emotional, and financial support as key pillars. But who provides that emotional care?
Hello, Li Chin. I'm the social worker here and has been working for about a year. So our main focus is patients. Just make sure they receive treatments regularly as scheduled, and make sure there's no difficulty for them to follow the schedules or come for the dialysis.
As a social worker, it's never an easy job. What's the hardest challenges you've ever come across?
So I think maintaining a non-judgmental attitude is actually very important. We may see there's a better solution, so-called, we always look for like a better intervention or better solutions for the patient, which we think that it could help them to have a better living conditions or managing their problems, you know. But then we are not them. They know their problem well. High chance they have been living in such situation for years. It's not just you can overturn the whole thing overnight.
How about emotional challenges?
I still remember when I first started my job. The impact is very strong. You may be talking to this elderly, then the next day, this person passed on. Like, it's like out of a sudden, you know, you still like, the person still seems well. Then you still like arranging, like, I'm going to see you next week, I'm going to see you when, you know. But then overnight, the person passed on. So I still very much remember my first client that passed away. That time I did like promise that, okay, you have no TV, okay, never mind, I'm going to source for a TV for you. So the next time that you have a TV at home, you know, that kind of thing. But then only a day after, then he passed on because of heart attack. So it's really caught everybody's surprise. It's also a lesson to learn that you have to do things fast, especially when you promise someone that having some illnesses like preconditions, or especially seniors, you know, just keep to your promise that you can actually deliver the service that you promised to provide.
What are the common problems that your patients face, like non-surgical?
For them, I think having dialysis 3 times a week, so that one really impact their employment. Those that are unfit to work means no income for the families, and those with families like spouse or children, it will be a financial burden for them because maybe the patient is a sole breadwinner in the family, so there's an impact on their financial.
And how do social workers like you help them cope with these situations?
So I think chit-chatting, casual talk will help to actually slowly let them open up and slowly accept the situations. For some cases, they may not be always not well. They can be better if their disease are more controlled. Even like maybe do housework for the families, you know, then they will slowly see their value. It's not just a patient that have to rely on their care.
So what's the difference between a nurse and a social worker?
For nurse, they are the one that actually on the medical care for the patients. But for social worker, we are actually the social, emotional parts that we focus on, how their emotion actually affecting their illnesses. Because sometimes it can be very surface, they can be a dialysis patient, yes, they have all these precondition, medical conditions, but they still want to be seen as a person, like what they are, you know. Maybe they used to be a clerk, they used to be a driver, you know, they used to be a manager. We have a lot of profession, you know, among them, they actually have their own career before they are a patient. So for social worker, we actually will take all this in consideration when we talk to them. We're not just talking to a patient, we're actually talking to them as what they are, who they are. This one will help them to discover back their values. Emotionally, it will help them to have more respect on themselves as well. Especially when they lost their job, they will see like almost like end of the world. You know, like they no longer able to earn an income for the families. They lost all this value of themselves. But actually, not totally true. They're still a person that very knowledgeable. They have things to share for the families. So we want to like fight back all this value for them.
Today, we join social worker Li Chin on a home visit as she checks in on one of her patients.
Yes. Good afternoon. Please. I'm Madam Kamsia binti Osman, coming 72 years old.
What kind of help did you first receive from your social worker?
My husband, that time, his cancer relapse again. When he cannot walk, bedridden already, nobody take care of me. Then I come to my social worker, need the help for me to have transport to come and pick me and send me to dialysis. The second time, I got problem about my helper. My helper, she's not mood to work. I don't know why. Then I crying there. Then she come to me and ask me about my problem. She know from others. She say, keep on talking and advise me. After that, I just notice everything settled back. Until now, my helper continue work with me, coming 10 months already.
So why do you choose to speak to a social worker as compared to like talking to your children about their problems?
I don't want to burden my children. No, they are working and helping me to settle all the hospital payment and my house rented, water bill, all my children will sponsor me, support me. Then only the thing is to make it clear, I had to find somebody can trust, I can talk.
How did you feel before and after speaking to your social worker?
I feel really, very, very happy lah, clear. I didn't feel burdened anymore because I'm alone. My children only come 2 weeks one time. I don't want to burden my children too much. As long they understand me, I also understand them. Make our family more happy. Then the things I got, my own social worker, even here, even hospital. My husband passed away 2003. I keep on crying. I also scared staying in this house alone. But I tried to fight. I thinking my husband's word, try to be strong, Kamsia, independent.
This isn't just about dialysis. It's about walking someone home from the hardest parts of their life. Day after day, person by person. That's what long-term care really means. At the Kidney Dialysis Foundation, caring for patients goes beyond dialysis. The foundation believes every patient deserves holistic, medical, physical, emotional, and social support. About 80% of KDF patients receive these services at no cost. To learn more, visit the link in the description box below.